Hello. We're seeing an increase in the number of postural and muscular dysfunctions that are being identified by the increasing numbers of corrective exercise professionals and corrective exercise specialists we're now seeing in fitness settings. One of our concerns here at the Medical Exercise Training Institute and postrehab.com is that in many instances, sometimes with corrective exercise training programs, we're forgetting the possibilities of other situations actually producing what look like postural muscular dysfunction. So in this slide presentation, I'd like to talk about the other possibilities that could possibly precipitate what looks like a postural muscular dysfunction, but actually is not. So if you would, indulge me for a few moments as we go through this slide presentation, just to identify some of the other possibilities that may appear to be postural or muscular in nature, but actually may be nerve-related, joint dysfunction related, or maybe a result of a lesion or lesion within one of the organ systems in the human body. When we look at postural muscular imbalances, we must make sure that we complete a thorough medical history. And that's not just simply chasing the client's symptoms of discomfort and pain, but getting an idea to see if there's a history of injury related to the client's postural muscular imbalance, which then moves the client from the corrective exercise category either into the post-rehab or medical exercise category. Now, during this medical history, we must make sure that we clear organ systems. That means that we must look beyond just simply postural muscular imbalances into the idea that maybe an organ system disorder is producing what we may view as a postural muscular imbalance. And as many of you know, I've been a physical therapist for many years. Back when I was a first-year physical therapist, I had a patient that I saw when I was in graduate school at Michigan State University. I was working in one of the hospitals there in Michigan, or in Lansing, I should say. And we had a young man that came in who was a former MSU football player. He was in his late 20s at the time, and he came in as a result of a motor vehicle accident. Now, again, I'm a first-year physical therapist. The client is, or the patient is referred in by a local physician, and after my assessment and evaluation, we determined the course of the treatment. And we got started with the physical therapy care and also gave the client an exercise program. Well, the young man came back a couple of visits, and on the third visit, he came in and he was coming in early in the mornings, and he just really looked sick. And also I could tell after this session, and normally after 3 sessions we normally would reevaluate, this young man was not making very much progress at all. So at the time I went back through and did an additional medical history just to make sure I didn't miss anything. So I retraced my steps. And what we found was the young man did have a motor vehicle accident that did increase his neck pain, but he had some degree of neck pain before the motor vehicle accident. He also was losing weight. He looked very sick. And one of the things he remarked was he was unable to sleep at night because as soon as he got into the supine position, he was unable to breathe or swallow. Well, that then made me start thinking of the possibilities of what could be going on. And also at the time, I was working in a small hospital, and the radiology department was right across the hall from the physical therapy department. The chairman of the radiology department and I played on the hospital basketball team, so I knew this gentleman very well. So I went across the hall, asked for him, and inquired about this young man's X-ray series. Now, as many of you may know, when an individual is involved in a very serious car accident, they'll shoot an X-ray where the individual is actually standing facing the X-ray machine with their mouth open. And what they're doing is they're actually checking to make sure the odontoid process is intact. Because once we have a fracture of the odontoid process, this could be fatal. Well, this young man did have an AP view where he actually had the mouth open and they shot this X-ray. But this X-ray also reveals what's going on in the superior lobes of the lung, and also would show any dysfunction, or particularly osseous or bony dysfunction in the cervical spine. Well, as soon as the radiologist pulled the X-ray and put it up on the viewing box, immediately he gasped, because the thing he saw immediately was there was a cloudy area in the lung. Well, with further testing that was done, once I communicated that with the client's primary care doctor, we found out that this young man actually had lung cancer, and the motor vehicle accident just simply precipitated what was already going on with the breakdown of the brachial plexus. That in turn caused numbness and tingling down the arm, but he had a small amount of that beforehand. Now, this is a situation, now, of course, this is in physical therapy, but this is a situation where we think there is a postural muscular imbalance because his diagnosis was just simply a upper trap and cervical strain. But in this scenario, by going back and doing a more thorough medical history, we started putting two and two together. And then, of course, with getting access to the x-rays and then further CAT scans and MRI studies, we found that this young man actually had a cancer. Now, this is a drastic situation, but it's one I want you to understand that can easily happen to you, because when individuals are coming to you, they're not going to their doctors, therapists, or chiropractors, but they're coming in for corrective exercise services. You must make sure that you do a thorough medical history and make sure that you clear all the associated organ systems. Also, with these clients with postural imbalances, it becomes important to obtain access to medical reports, including x-rays, MRIs, CAT scans, if the client reports a history of injury, reports a history of significant pain, pain beyond the level of, say, a 5 on a 1 to 10 scale, but also a history of injury in that area. Now, we're not saying that you need to be the doctor, the therapist, or chiropractor, or now start to diagnose. We certainly want you to look at the idea of going beyond just simply a couple of testing procedures and saying, hey, it's all postural or muscular, when it may not be. Now, there's a 75% possibility it may be more than a simple postural or muscular imbalance. And let's talk about that a little bit more now. Let's go back to our previous slide here. And you can see with this postural or muscular dysfunction, it could be a nerve compromise, a joint dysfunction, an organic lesion, and then, obviously, a muscular involvement. But you'll see here, there's a 75% possibility it could be something else. So we go beyond this, we look at nerve compromise, there's a 25% possibility that postural muscular imbalance could be a nerve compromise. So in this situation, you want to look for the client that's having numbness or tingling, radiating pain. They have a loss of sensation, and they have weakness, and the weakness is in a certain myotome, or the loss of sensation is in a particular or specific dermatome. Now, if you're not familiar with the idea of myotomes and dermatomes, this is something that you may want to familiarize yourself with and be able to conduct a basic myotome and dermatome assessment when a client comes in and they're reporting numbness and tingling, radiating pain, loss of sensation, and significant weakness. So again, there's a 25% chance that this postural muscular imbalance actually may be a nerve compromise. So make sure in your medical history you're asking the client if there is a situation or there are symptoms of numbness and tingling, radiating pain, loss of sensation, and or weakness. The next possibility is a joint dysfunction. There's a 25% possibility that that postural muscular imbalance is actually a result of a joint dysfunction or a joint injury that may involve a ligament, cartilage, or capsular involvement. Now, I'll give you an example for me. As many of you know, years ago, I was young and dumb, and I was a paratrooper. I served with the 82nd Airborne, and I jumped into Grenada back in the early 1980s. Well, I was a lieutenant at the time, and I jumped in, and I injured my right hip, or what we thought was a groin injury, on that parachute jump. Well, I walked around on that pulled muscle, or pulled groin muscle, for 3 or 4 days. Our medic actually taped me up with the idea that I just simply pulled a muscle when I landed, because I could move around, I could run, and I could walk, but it was extremely painful, and the pain was all in the groin region, radiating down the medial aspect of my thigh. Well, eventually I was medevaced out, and I was sent to Panama, and I was seen at a hospital in Panama, and lo and behold, on the x-ray, they found I had a dislocated hip. It obviously happened on the parachute jump, but with the adrenaline flowing and the situation we were in, I just kept moving, and eventually the medic taped me up, and with that taping the medic did, with just simply an ace bandage, it made me feel better, maybe took a little bit of pain away, but I actually had a joint dysfunction. I'd actually had a hip dislocation, which actually resulted in some capsular damage. Well, that proves there's a 25% possibility that that postural or muscular imbalance can be something else. Now, in these situations, these individuals will report with limited range of motion and function, significant pain. That means on a 1 to 10 scale, their pain levels are 5 and above. They may also have swelling, and this now requires the use of special joint testing procedures to determine if there's ligamentous damage, cartilage damage, capsular damage, which sometimes goes beyond the scope of the corrective exercise professional. So again, in your medical history, that you do prior to touching the client, doing any type of screening, you want to make sure that you ask the client if they're having any significant pain, loss of range of motion, swelling, or loss of function. So again, there's a 25% chance that postural muscular imbalance could be a joint dysfunction. Now, the next possibility is an organic lesion. Okay, there may be an internal organ system dysfunction that may manifest itself to look like a postural muscular imbalance. Again, these appear as postural muscular imbalances. So one of the things we need to do is look for universal signs of cancer. That means if the client has had a significant weight loss, if there's been a change in a mole or a patch of skin, if there are any changes in bowel or bladder habits, particularly if we're seeing any type of blood in the stool, so things of that nature. So you want to make sure that you clear the organ systems with an extensive medical history and or refer the client out to a physician. If you're starting to feel in this medical history, the client is giving you answers that indicate something is involved beyond just simply a postural muscular imbalance. And also, this client will look sick. In the situation I had earlier with the gentleman that had the actual cancerous lesion, this gentleman looked sick. Now, let me share another story with you. And this is a story that occurred probably somewhere between my 4th or 5th year as a physical therapist. At that time, I was director of the Sports Medicine Center. We had a young lady that was referred to us by a local orthopedic surgeon. He referred her with the diagnosis of a sacroiliac dysfunction. Well, she comes in, and of course, she does have pain in the sacroiliac area. I go through the normal assessment procedures for the SI joint, and lo and behold, she does have some SI joint pain that is provoked with these procedures. Now, remember, assessment procedures are designed to provoke the client's pain. So if you can actually elicit the client's pain with certain maneuvers, then that indicates that problem is related to that maneuver, and then that will give you an idea of the client's problem. Well, after the 3rd session, the client comes back, and again, we're not making significant progress, so I go back through, I retrace my steps with the medical history and the assessment, and somewhere in the process, it dawned on me, something I learned in PT school and the advanced orthopedic training I had, that for clients, particularly female clients, and this young lady was in her 40s, that they're coming in with SI joint problem or pelvic disorders, to make sure you have them cleared by their OBGYN to make sure there are no urogenital issues. Well, of course, when I asked this woman if she had seen her OBGYN in the last year, she, of course, reports no. So I send her back to their gynecologist, and lo and behold, she calls me a couple of days later and says that she has a large ovarian cyst that is causing the pain that she's having in her SI joint. Now, folks, if you understand referred pain patterns, the ovaries actually will refer their pain posteriorly into the SI joint region. They also can refer pain down into the lower anterior portion of the pelvis. Well, interesting enough, that was the exact same pain scenario that we saw, but with my testing, it indicated that it was an SI joint problem. But more importantly, I just simply eliminated in my mind the possibility that this woman was coming in with anything other than a musculoskeletal issue. Well, after she saw her OBGYN, they found out that she had an ovarian cyst. A couple months later, I got back in contact with this woman, and after a process of pharmaceutical treatment and other things, found out that she actually was doing fine. Now, please, don't get me wrong. I'm not saying that every client that comes in your door is going to have an organic lesion or have these other things. But I am saying when these clients come in and they have what appears to be a postural muscular imbalance, make sure that you do clear the organ systems, because in this situation, there's a 25% chance it's an organic lesion, and an organic lesion means there's an internal organ system dysfunction that's manifesting itself as what appears to be a postural muscular imbalance. Now, there's a 25% chance that postural muscular imbalance is truly that, muscular involvement. Now, a couple things here. When you look at this client, they're going to have pain with the contraction of the muscle or muscles that are involved, the muscle group involved. You're going to find that passive movement will be less painful because the contractile tissue isn't working. They may have limited range of motion and limited function, and muscle flexibility testing may reveal specific limitations, but we need to assess specific muscles for flexibility. Also, we found with the corrective exercise assessment process that the functional squat may be somewhat misleading. So make sure that you do look at each individual muscle for flexibility issues. So make sure you assess each individual muscle and make sure you go back and review Yonda's theory on the cross syndromes, both the upper cross and lower cross. I think that if you go back and review Yonda's theories and actually read those papers, it'll give you a better insight into what we're really looking for with postural muscular imbalances. Now, this whole concept of screening the client and clearing organ systems will be covered in our upcoming MEDEX Pro Summit that will be held at Medical Fitness Pros, our facility here in Houston, and that will occur October 24th through 26th of this year, 2014. To get more information on our MEDEX Pro Summit, go to medexprosummit.com. And with this summit, this year's summit is going to focus on you, the medical exercise professional, and the assessment process, but also the screening process for those individuals that are coming into your facility that are not being referred by a doctor, therapist, or chiropractor. How do we appropriately screen those individuals and then refer them on to the appropriate medical professional? So this year's MEDEX Pro Summit will really focus on you, the medical exercise professional, in giving you the additional skills, knowledge, and management capabilities to move that inappropriate client to the appropriate medical professional, but also to identify them. So again, thank you for taking the time to listen to this presentation. We hope to see you at our MEDEX Pro Summit. And again, best wishes to you in building your medical exercise training practice.